Hello, I'm Dr. RaviGoel. I'm going to give you pearls on using surgical face masks, gloves, and face shields in the office. The CDC has published pearls on using surgical face masks. You want the face mask to fit snugly, be secure, and allow you to breathe properly. So when I take this surgical face mask, the outside is marked. I'm going to tie it on the upper part around the bridge of the nose, and also I want the lower part of the face mask to fit under the chin, and I'm going to tie the face mask. I'm then going to make sure with both hands, I'm going to make sure that this metal strip is snug, so that in my case I'm wearing glasses. When I breathe, I'm not getting any fogging of my glasses. Putting on gloves is pretty self-explanatory. The pearl for gloves is that if you believe that the gloves are contaminated for any reason, you want to be able to remove the gloves properly. And here are some CDC pearls. But basically, when you take gloves off, you can grab the glove without touching your skin so that it collapses. And then you can grab the other side without touching the skin so that both gloves collapse and you can dispose of them properly. The NIH has published guidelines for printing face shields using a 3D printer. So in my case, I had a face shield printed, 3D printed. I then purchased Avery durable plastic dividers as well as rubber bands, and I could easily use a face shield in the office. These face shields have the plastic dividers which can be removed, cleaned, and disposed of, as well as the rubber bands can be removed. So these are 3D printed face shields available from the NIH website, and we'll have links available for them. Thank you and have a great day. Be safe.